Hello, my name is Monica Chavez and I'll be doing my presentation on pregnancy. So how it begins. Pregnancy occurs obviously through fertilization. Fertilization is the union of the sperm and the ovum. The ovum is an egg that contains the genetic materials that will be contributed to the baby by the mother. So what occurs? First of all, the sperm enters the female body and immediately surrounds the ovum. Second, one of the sperm is able to penetrate into the ovum. And thirdly, the fusion of two cells form in the nuclei of the cell, meaning that fertilization has occurred. So pregnancy on average is a process of 10 months of development. These 10 months are divided into 3 trimesters. Each trimester is different for both mom and baby. So the first trimester consists of week 1 through week 12. Week 1 is actually when pregnancy began, and it starts counting from the last menstrual cycle of the female. Week 2, 3, 4 are the weeks where the female body prepares for ovulation and eventually fertilization, and most likely when the woman misses her menstrual cycle. Week 5 and 6 are when the baby starts to take a form. The neural tube will develop, and this is where the brain and the spinal cord start to grow and develop. Baby is now called an embryo. Weeks 7, 8, and 9 is when there will be a lot of new development. The mouth, the nostril, ears begin to form. By week 9, her fingers and toes will also develop, and her reproductive system internally will also start to form. Week 10, 11, and 12 is when the baby's vital organs will form, and during these weeks the baby will begin to dramatically grow. By the end of this trimester, baby can be about 3 inches long. So first trimester for mom is full of new feelings. This is when these feelings are what helps mom know she's pregnant. She can start feeling tiredness, sickness, illness, breast tenderness, morning sickness such as nausea, and all of these feelings are due to the hormones that develop after the implantation of the baby. So second trimester. The second trimester consists of week 13 through week 24. Weeks 13, 14, and 15. During these weeks, the baby's vocal cords develop. Her small reproductive system begins to grow. If it's a boy, the prostate gland forms, and if it's a girl, the ovaries start to move into the pelvis. Baby can even start to wiggle toes and fingers. Weeks 16, 17, 18, baby begins to strengthen a lot. A lot of growing takes place. Baby's lungs start to prepare to take in oxygen, and baby can even start to perceive some light, although it can't open its eyes yet. Weeks 19, 20, and 21 is when the baby's brain begins to develop millions of neurons. Her kidneys start to function, and baby may even be able to hear mom talk or hum, sing. Her digestive system also begins to work because baby starts absorbing small amounts of sugars from the atomic fluid which is inside the placenta. Weeks 22, 23, and 24. During these weeks, baby will be able to recognize mom's voice. The baby's development focuses mostly on breathing, and by the end of week 24, baby could be about 8 inches long. The baby also can be very active, and mom should be able to feel it by now. Second trimester for mom is full of a lot of emotions. Because moms now can feel baby inside moving. This can cause a lot of happiness, emotions, surpriseness. Also, random feelings will occur out of the blue, such as crying for anything, being annoyed by any little thing, laughing for nothing, getting mad for nothing. These are also due to hormones. And also during second trimester, belly begins to expand. So third trimester. This consists of week 25 through week 40, weeks 25, 26, 27, and 28. During these weeks, baby begins to be extremely active. Baby's head should be fully developed. Lungs and liver and the immune system should be maturing. and by the end of week 28, baby can or is able to open his or her eyes. Weeks 29, 30, 31, and 32. During these weeks, baby's development is focusing on maturing her lungs for birth, expanding the brain growth, practicing sucking and swallowing. By the end of week 32, baby could be about 11.5 inches long. Week 33, 34, 35, and 36 is a lot of wrapping it up development. The due date is near, so baby could be reaching its ultimate birth weight. Fingernails have completely grown, and baby could be in a head down position in the woman's pelvis. By the end of week 36, baby is considered full term. Week 37, 38, 39, and 40 are when baby simply finishes maturing her functions such as breathing. Baby is now reached its ultimate birth weight, and by the end of week 40, baby can be anywhere from 18 inches to 21 inches long. So for moms, the third trimester is full of anxiety. Mom wants to know when the baby's coming. Also, mom could start to feel back pains, cramps inside, especially in the legs, heartburn, and by getting near to the end of the third trimester, a lot of contractions. So risks during pregnancy, there are many factors that can affect healthy development. Drugs, alcohol, and antibiotics are some of the main ones. These cause serious damages to the baby's development that can cause miscarriages and death. They have a huge effect on developing mental disorders, learning deficits, physical defects. They can prevent baby from developing legs and arms, and they are linked to hearing loss if these are taken during pregnancy. These are the risks that moms attain to. There's also psychological risks, which are stress levels and depression. These are due to the environment and the support that mom has. What type of environment does mom live in? Is she stable? Does she have a place to eat and sleep? If not, this can affect the mother's brain, causing stress of just thinking, where am I going to sleep today? Where am I going to eat? Also, is there support from the family? Is there support from the baby's dad? Does she have the support she needs to make this a positive pregnancy? If not, negative things can occur which lead to stress and depression, causing the mom to think, what am I going to do? Who's going to help me? And depression and stress level are linked to having the baby come early or even have a miscarriage. Depression is a huge issue. It can lead to mom wanting to have suicidal thoughts or take substance abuses. It can cause serious effects of the development of the baby, and this is proven by research. So what can be done? In order to help prevent such risks, there are many things. First of all, mom can start by avoiding all types of drugs, alcohol, even tobacco. I could avoid antibiotics or check with doctor what is okay to take during pregnancy. Eating healthy, having prenatal vitamins can help have a healthy development in baby. If mom does have stress, depression, is always thinking about where she's going to live or stuff, there's counseling available, or there's helplines that can help mom find a place to stay, that can help mom find a job. There's always help out there, especially churches offer a lot of help for pregnant women who have this risk, because they don't want to have mom feel stressed or depressed, because it is going to have a negative effect on baby as well as mother. This concludes my presentation, and if all these things are done, pregnancy can be one of the most beautiful experiences a woman goes through, and I know it is, because I had just been pregnant, and the results are wonderful. So thank you very much for listening to my presentation.